Augustine. And maybe if you would introduce yourselves and then tell us a little bit about the case, overview if you want, and then we'll start.
Okay, so I'm Carmen and they are Ludovico and Paula, and our case has been about I don't know if any of you have followed this case in the press, but it's about the ASR hip implant developed by Johnson & Johnson. And well, those implants have caused several pain, suffering, damages to the patients that had those implants. And well, actually there has been a billionaire settlement for some of the claimants and people that have been affected here in the US, but also they were sold overseas. And our case tries to analyze the behavior of Johnson & Johnson and the impact that has had on its corporate reputation. I'm sorry, I'm not a native speaker, maybe.
Okay, and you want to introduce yourself too?
I am Ludovico. I study a BA in Law and Economics.
Okay.
And my name is Paula, and I'm also a student at the Universidad of Navarra of Global Management and Law.
Okay, and when we start, this will be strictly about the ethical implications, focusing on that, correct?
We'll try.
Okay. Oh, no.
This is good.
10 seconds.
Wait a minute. I think that's going to do Okay. I think I did it. Now, are you all ready?
Yes?
Yes.
Okay.
So, good morning, ladies and gentlemen, and members of the Board of Directors of Johnson & Johnson. First of all, thanks for the opportunity of being here once again, this snowy morning of December 2013 at your corporate headquarters in New Brunswick, New Jersey. Now, we're going to make a brief summary about the ethical implications of the ASR hip implant scandal. This morning, while we were coming here in the car, we were wondering, what makes you buy a certain hip implant? You have to undergo surgery? Why you choose Johnson & Johnson hip implant? Why don't you choose Zimmer's? Why don't you choose Stryker's? When you go to a drugstore, you see thousands of pills. Why buy Johnson & Johnson? Why not another brand? And the three of us, we had the same unanimous answer. Trust, respect, confidence. If you don't admire the company that is selling your product, you will never give a pill of that company to your children. You will never recommend to your friends or to your grandmother their hip implant. Johnson & Johnson used to be one of the most trusted, admired, and respected companies in the world. Its credo has shaped its company since its foundation and has inspired generations of students, businessmen, leaders, and even competitors. If you have noticed, I said we used to be one of the most admired companies. According to the Fortune list of world's most admired companies, before the hip implant scandal, Johnson & Johnson was one of the most admired companies in the world, ranking consistently on the top 5 positions of the list. Today, we're on the 23rd place, and we wonder, how could all of this happen?
In 2003, keeping with our innovation and leadership spirit, we were one of the first ones to launch the metal-on-metal implants into the market. We saw here both a great opportunity to help and improve our patients' quality of life, as well as to grow in a new potential market. However, what we did is that we rushed. We just wanted to save costs and time, and we were able to do that following a program developed by the FDA that is called the 510K. This program didn't require us to perform clinical trials, but even though we weren't required to perform those clinical trials, we should have done them, because quality and safety are really important for us. And these clinical trials, maybe they could have made appear all the potential risks of our implants. These risks and problems actually started appearing around 2008, and thousands of patients started suffering severe problems like severe inflammation, bone fractures, and also walking difficulties. Moreover, due to all these problems, we were forced to sign a settlement agreement this last November 2013, but this agreement is not covering them properly and is not covering also all the patients. So should have we done something more? Are we really responsible for the damages we are causing our patients?
Well, let me answer that. We are responsible for the damages caused by our hip implants. we are ethically responsible for them. Why? Because we had the knowledge. We knew that those damages would arise from our implants. Not only that, those damages could have been easily avoided if we had behaved differently. So, how am I so sure that we knew? Well, in August 2009, there was a letter sent by the FDA to our Vice President of Scientific Research and Development. In that letter, the FDA expressed their concern about the safety of our implants. They asked us to do clinical tests. They weren't sure why our our implants were failing so much. And what we did with that? Well, that email was forwarded to the CEO of Johnson & Johnson, of this board of directors, and the suggestion, the comment made by the vice president was that we shouldn't do any additional clinical tests because we weren't going to pass them. We used it as an excuse the decline in sales we had in 2009 to stop producing our implants, and we sold all the inventory that we had left. Instead of starting an immediate recall of our products knowing that they weren't safe, we kept selling them. We kept selling them both here in the US and overseas until 2010 when we started a global recall program. I mean, I think that ethically we should have behaved differently. But not only this, I mean, we had no idea before of what was going on. Well, there were several things. First, there were more than 850 reports with complaints sent to the FDA in the 4 years previous to the recall. What we said about those complaints, about those failures, is that they were due to the surgeon's lack of ability performing the surgery required by the hip implants. But not only this, also the scientific community tried to warn us. There were several research done and published reporting a failure rate that was twice the failure rate of our competitors and even 6 times higher than the failure rate considered acceptable by the FDA. And not only this, when we designed the implants, there were mechanical tests conducted, and those mechanical tests showed that the metal debris generated by our hip implants was 16 times higher than those of similar products. I mean, that should have ring a bell that our products weren't safe and that we shouldn't have sold them. So now, what are we going to do about this? What we should do in order to restore the trust that our patients have in us, in order to restore the corporate reputation we have, in order to behave ethically again. What are we going to do?
As we have just seen, we are ethically responsible for all the damage and pain suffered by all our patients and their families. We have bring with us today 5 recommendations for this not to go and happen again. But we have to warn you, change is a very powerful tool, but it has to come from somewhere. It has to be born somewhere. It has to root somewhere. While we were coming here this morning, downstairs, this headquarters, we saw a beautiful engraved credo of the company near a flag of the United States. So our first recommendation is those words are not a piece of furniture. They are not fancy. They are not decoration. They have to live in the hearts and in the souls of every single worker of this company. That's our starting point, and that's how we're going to change. So our first recommendation is, doesn't matter if the FDA doesn't require clinical trials. We are the #1 medical device and pharmaceutical company in the whole world. We always perform clinical trials. Patients are our more important stakeholders, so we have to ensure our products are safe. Second, our settlement agreement program has to cover every single patient affected by our hip implants. Doesn't matter if you were born in the United States, if you're a smoker, if you're unprotected, or if you have 5 or 6 children. You have to be covered and properly compensated. Talking about the compensation, it's not a matter of paying as less money as possible. It's not a matter of only covering medical expenses. People's life is at stake here. We have to compensate them for all the pain they have suffered. It's not only a matter of money, and this is our 4th recommendation. We don't only have to pay those patients. We have to take their hands, look them in the eye, and say to them, I'm sorry, we missed this. We're not going to do it again. That's the only way we will restore their trust. Last but not least, culture and standard ethical protocols. Our company has grown in the past years, acquiring other companies. When we design a product, when we hire a new worker, when someone joins our family of companies, we have to ensure that they understand properly what is the ethics of this company. We have to establish the proper ethical protocols to ensure they fulfill the ethical standards that have made us the #1 company in the world. Thank you.
Thank you. I thought you did a very, very fine job.
Thank you.
And what feedback I have is that I was, as a board member, horrified
That's good.
at this lack of sensitivity and ethics toward our patients. I mean, putting out this device without appropriate clinical trials is not the way we should be acting, and we should go back and look at our credo and realize what it's telling us and have a whole new credo examination. If it doesn't mean anything, we should take it off our walls. If it does mean something, we have to follow it. I think you made that clear, so thank you very much. And why can't I speak other languages besides